The year 1918 began like any other, filled with the usual hopes and dreams, but it soon became a year etched in history by a killer. This killer was not a person or a weapon but a virus, invisible to the naked eye yet deadly in its reach. The Spanish flu, as it came to be known, swept across the globe with terrifying speed, leaving no corner of the world untouched. Unlike other flu outbreaks, it didn't just target the very young or old. Healthy adults were struck down in their prime, causing widespread fear and uncertainty. It was a global pandemic the likes of which the world had never seen. The numbers were staggering, and the impact was felt in every community. It's estimated that 1/3 of the world's population, about 500 million people, were infected, a scale of infection that was unprecedented. The death toll was unlike anything experienced in modern times, with entire families and communities devastated. While estimates vary, it's believed that at least 50 million people, and possibly as many as 100 million, succumbed to the deadly virus, a staggering loss of life. The world was wholly unprepared for the devastation wrought by this microscopic enemy, and the lessons learned from this dark chapter in history continue to resonate today. The 1918 flu was not like the seasonal flu we know today. It was far more aggressive and deadly, sweeping through populations with alarming speed. Symptoms were swift and severe, often appearing within just hours of infection, leaving little time for intervention. A high fever, headache, and debilitating body aches were common, making even simple tasks unbearable. But what set this flu apart was its devastating impact on the lungs. Many victims developed a horrific pneumonia which compounded their suffering, their lungs filled with fluid, making breathing a struggle and often leading to suffocation. Faces turned blue from lack of oxygen, a terrifying sign of the body's desperate fight for air. Death, when it came, was often agonizing, leaving families and communities in despair. Doctors were baffled by the ferocity of this new strain of influenza, struggling to understand its nature. They had no effective treatments, and antibiotics, which would later revolutionize medicine, were still decades away, leaving them helpless. The world in 1918 was already reeling from the First World War. Millions of soldiers were crowded into trenches and training camps, creating ideal conditions for the virus to spread. Movement of troops across continents inadvertently helped the flu reach every corner of the globe. The United States, though relatively late to enter the war, was hit particularly hard by the pandemic. Military camps became breeding grounds for the virus, and as soldiers returned home they carried the deadly illness with them. Cities and towns were overwhelmed, hospitals overflowed, and makeshift infirmaries were set up in schools and other public buildings. Fighting a ghost. Doctors in 1918 were fighting an invisible enemy. They lacked the tools to identify the virus or understand how it spread. Microscopes of the time weren't powerful enough to see the virus, and the science of virology was in its infancy. Without a clear understanding of the cause, doctors were essentially helpless to stop its spread. There were no vaccines, no antiviral medications, and no respirators to help those struggling to breathe. Treatment consisted mainly of palliative care, trying to ease the suffering of the sick. It was a desperate time, and the medical community felt overwhelmed and defeated. Stopping the invisible enemy. With no cure in sight, communities resorted to desperate measures to slow the spread of the virus. Schools, churches, and theaters were closed, public gatherings were banned, people were urged to wear masks and practice rigorous hygiene. Just like in recent pandemic COVID-19, it's difficult to say definitively what brought the pandemic to an end. Some believe the virus simply ran its course, mutating into a less lethal form. Others point to the effectiveness of public health measures, however drastic, in slowing transmission. Prevention of a pandemic. The Spanish flu pandemic of 1918 to 1919 was a stark reminder of the devastating power of infectious diseases, sweeping across the globe with unprecedented speed and lethality. It exposed the vulnerabilities of a world unprepared for such a widespread health crisis, revealing the gaps in medical knowledge and infrastructure. Yet, it also highlighted the importance of public health measures in controlling outbreaks, such as quarantine, social distancing, and the use of masks. The lessons learned from this devastating pandemic continue to shape our response to infectious diseases today, influencing policies and preparedness plans worldwide. It underscores the critical need for ongoing research, vaccine development, and global cooperation in the face of health threats, emphasizing the importance of a united global effort. The shadow of 1918 serves as a reminder that the fight against infectious diseases is far from over, urging us to remain vigilant and proactive in our efforts. But by the summer of 1919, the flu pandemic came to an end, as those that were infected either died or developed immunity.